Hi, James.
Hey.
How's it going?
Pretty good.
Okay. Well, my name is Sarah. I'm going to be your nurse practitioner today.
Okay.
I work with the physical therapy department.
Okay.
You're here for a shoulder injury, is that correct?
Yes, that's correct.
Okay. So tell me what's going on today.
Just having some pain in my shoulder. If I fully extend it, I can't move it all the way.
Okay.
I was getting out some Christmas decorations from the attic, and the box was kind of heavy, so when I grabbed it, something pulled. I don't know exactly what happened.
Okay.
But it's really tight. I can't move it how I used to move it, and it's a little bit sore as well.
Okay, so how long ago was the injury?
This was 3 days ago.
Okay, so persistent kind of pain and discomfort for 3 days?
Yes. Yes.
Okay. So I'm just going to write a couple things on our mobility chart here.
Okay.
It's going to help me keep track of your progress. I'll take a couple notes on your plan for today.
Okay.
So this is day 3, you said.
Yes.
It's day 1 of our assessment. As far as your general mobility, are you still able to carry on your day-to-day activities? Like
I am.
dressing yourself?
Yes.
And did you drive? Were you able to drive?
Yep, I
Okay.
was.
So still pretty independent as far as your overall mobility.
Yes.
So I'll give you a 1 for your independence.
Okay.
And what would you say your pain level is kind of right now at baseline?
About a 4 out of 10.
So a standing 4.
Yes.
Okay. And extremely exacerbated pain, like the worst level that it goes to, maybe after you try to lift something or when you try to raise your arm, what would you say it goes to?
I would say 7 at the most and 8.
Okay, so 7 to 8.
Yes.
Are you taking anything for the pain?
Just some Aleve.
Is that helping at all?
A little bit.
Okay.
But I don't want to take too many, but it does take the edge off.
Okay. How many times have you taken it today?
Just once today.
How long ago? Like
About,
within 4 hours?
Yeah, 2 hours ago.
Okay. Okay, so that just kind of gives me an idea of what your overall pain is today.
Okay.
I'm going to do an assessment for sure. I want to test your range of motion comparatively to the other side.
Okay.
And see what your limitations are, and then we'll kind of come up with a game plan to see what we can do to hopefully not further the injury and have it progress further. We did do the CT and it was negative, so there's no like acute muscle strain. You don't have any ligament tears or anything like that. So that's good news. Most likely you just kind of irritated your rotator cuff a little bit, which can happen if you're trying to go to lift something and then you're overcompensating by raising your arm up inappropriately.
Right.
It's a common injury that we see this time of year, especially people putting up their Christmas lights and stuff. So we'll have a look at that. Okay, so I'm gonna, right now you said your pain level's a 4.
Yes.
I don't want to make the pain any worse. As we're I do want to assess what's going on, but I don't want to cause you any discomfort. So is it okay if I spray a little bit of lidocaine spray once we get started with the exam? It'll just give you like a topical pain relief. Okay, so I'm gonna have you change into a gown if that's okay, just so I can have access to your shoulder and a little bit of your back. Okay. I have a gown here for you. Have you put this on? I'll step out of the room and I'll come back in and then we'll start with the assessment, okay? All right, thank you.
Yep.
All right, James, how are you feeling? Are you comfortable?
Yes, I am.
Okay. So I'm gonna go ahead and remove the arm of the gown. It'll open up.
Okay.
I'm just start here, just untying the back. And I'm just gonna open it a little bit if that's okay.
Sure.
So just to start, I want to have a look over your skin. Let me know if any of this is painful. I do see a slight bout of swelling here. Is this area painful?
No.
Okay. I'm not noticing any discoloration in your skin or abnormalities in your skin itself, which is good. Okay. Have a look around the back, okay? So I'm going to go in with my stethoscope. I want to just have a listen. Just take a couple normal breaths, okay? So everything sounds normal.
Okay.
I'm not hearing any occlusions or blockages where I don't hear blood flowing, so that's good. And I have a little light. Just gonna turn it on and have a little bit of a closer look, okay?
Okay.
I'm just checking for any obvious signs of edema or injury. Just on a very superficial level. Doesn't look like your shoulder is like dislocated. I'm not seeing any issues with your clavicle. Skin looks healthy, like I said. Can I have you turn your head towards the wall for me?
Sure.
There you go. Okay, you can relax. Okay. So externally, everything appears normal. Okay?
All right, good.
So if it's all right with you, I'm going to go in with a couple of tools. I want to start by checking your sensation. I want to see if there's any just kind of general sensation loss. Is that anything you've been noticing?
Not really.
Okay. So I'll just do a very basic inspection, check your sensation, and then we'll move on, okay?
Okay.
So I have a couple different tools. I'm going to start with something very simple. I have 3 different things. So if you can just hold your palm out for me. So this is what I would say is dull.
Okay.
Just a dull flat surface. We'll call this soft.
Okay.
And this will be sharp for the purposes of the test, okay?
All right.
So I'm going to alternate here. Are you able to feel that this is soft?
Yes.
And this is sharp?
Yes.
And this is dull.
Okay.
Okay. So we'll start out with those 3, okay?
Yes.
So I want you to tell me, you can say yes and sharp, soft, dull, whatever you feel.
Okay. All right, soft. Sharp. Soft. Dull. Soft. Sharp. Sharp. Dull. Soft. Dull. Sharp. Soft. Dull. Soft. Sharp. 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 Dull. Soft. Dull. Dull. Sharp. Soft. Dull. Dull. Soft.
Okay, good job. Now I'm going to switch. Instead of this being dull, I'm going to have this be dull.
Okay.
Okay? And this time I'm just going to alternate between sharp and dull.
Okay.
Can you tell the difference?
Yes, I can.
Okay. So this time just say sharp or dull.
Okay. Sharp. sharp, dull, sharp, 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 dull, sharp, 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 dull, sharp, dull.
Okay, very good. And now I want to do the same thing, but I want you to tell me if you feel pressure or sharp.
Okay.
So this is sharp and this is pressure. Can you tell the difference?
Yes.
Okay.
Sharp, pressure, sharp, pressure, 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 sharp, sharp, pressure, sharp, pressure.
Very good. Okay. So I'm not noticing any issues with your sensation. I do want to check. This time you're going to feel it throughout, and I want you to just tell me if it's any less sharp as I go through. It's going to feel like this.
Okay.
So it is pretty sharp, and I'll be rolling it along your arm in various directions.
Okay.
So for example, if I do it here, and for some reason here it feels less sharp than it does here, just let me know, okay?
Okay.
So just going along. Does this feel pretty even?
Yes.
Even all the way down
Less sharp towards the end.
towards here?
Yes.
Okay. And here.
Less sharp in the middle.
Here?
Yes.
Okay.
About the same.
So still less sharp here.
Yes.
Okay. And here.
Less sharp in the middle.
Here.
Even.
Okay. Now I'm going to go this way, okay?
Okay. Feels the same all the way through. Yep, sharp the whole time. Sharp the whole time. Sharp the whole time.
Good.
Whole time. Yeah, all sharp.
Okay, and last one.
Sharp the whole time.
Okay. So the only area that you were having issue with is here where I said I noticed that swelling.
Yes.
And it also was only in this direction, correct?
Yes.
So here feels less,
Mm-hmm.
but here feels the same.
Right.
Okay. And this feels less than this.
Yes.
This more than this.
Correct.
But this, and this feel the same.
Yes.
Okay. Okay, so definitely a little bit of loss in this area. There is some noticeable swelling. It's nothing so apparent that you would see it maybe if you were looking in the mirror, but if I just run my fingers across here, I can tell that you have a little bit of edema there, okay?
Okay.
So is that something that you noticed prior to the injury, or do you think it's probably related?
I think it's related.
Okay. Is this specific area where you feel pain, would you say, or
No,
not really?
Just a little numbing, a little dull.
Okay. And where exactly in your shoulder, arm would you say the pain is? Is there like a specific pinpoint area, or is it kind of everywhere?
Kind of towards the back of my shoulder.
Here?
Yes.
Okay. So I'm gonna feel around, and some areas I'll push slightly harder than others.
Okay.
I want you to try to pinpoint exactly where in the joint the pain is coming from, okay?
Okay.
So I'm gonna come a little more behind you. And I'll start by palpating here. And I'm just going to continue to move around. And like I said, I want you to just tell me where you feel it most painful.
A little little bit there.
Here?
Yeah.
Okay. So I'll keep my hand there. Nothing over closer to your spine. A little bit.
Right there.
Here?
Yes.
Okay. So here and here.
Yes.
Anything kind of further back?
I don't think so.
Okay. So very, very close to the spine here, and then here, kind of directly where your muscle connects.
Yes.
Okay. And here, is it kind of radiating higher up or more lower down?
Higher up.
Okay. So these areas connect. Do you have kind of like a trail of pain here?
No.
Not really.
It's kind of spotty right there on the end.
Definitely here.
Yes.
Definitely here.
Yes.
Okay. Okay, so this is running along your tricep. I'm going to test for a little bit of range of motion, and when I do, I'll be able to palpate your muscle a little deeper.
Okay.
And then further into the exam, I'll have you turn around and I'm going to have a look at your back, okay?
Okay.
So I'm going to go in with a reflex hammer. And this is going to cause a little bit of pressure, so it's going to feel like a dull tapping.
Okay.
Okay. Let me know if this causes you too much discomfort, okay?
Okay.
So definite pain here. So that should feel slightly more uncomfortable than this.
Yes.
Okay. So I'm listening for any kind of dull, echoey sounds, which can indicate that maybe something was missed on the CT, in which case we would need to get an MRI to look for any signs of deeper injury. No pain in any of these other areas as I go through.
No.
I'm going to kind of tap across here. I want you to tell me when it starts to hurt more.
Yes.
Here?
Yes.
Okay. Tell me when it stops hurting so much.
Yes.
Here. So about here to here. Okay. So I'm going to come down and I want you to tell me when it doesn't hurt as much.
There.
Here. Still painful here.
A little bit, yes.
Less painful here.
Yes.
Okay. Go up this way. Does it feel okay over here?
Yeah, it feels okay.
And up, pretty painful across here?
Yeah, right there.
Okay, so of this area, we've kind of boxed off a quadrant here. Is it more painful up top or directly across?
Up top.
Okay. So here is probably the most painful spot.
Yes.
Okay. So I'm going to do that again with a different side of my hammer. This is going to help me pinpoint just a little bit more. So if this area is painful, what would you rate it as on a scale of 1 to 5 as I kind of go across, 5 being the most painful?
3.5.
And here?
2.
And here?
1.
Okay. So 1 is more painful for you?
No, 1 is less painful.
1 is less painful, okay.
Right there is kind of the most.
Here?
Yeah, it's about a 4 right there.
Okay. Okay, I'm just trying to feel in between. Okay. I'm gonna come over on this side. I have a duller hammer here, okay? So it's just a little tap. I'm just feeling for any pushback of your muscle. If I kind of palpate deeper, does that subside the pain a little bit or make it worse?
A little bit subsiding.
Okay.
Yeah.
Okay. So I'm definitely feeling some tension. I think we might need to do a little bit of pinpoint therapy.
Okay.
Sometimes when you put pressure directly in between the muscles, it can help force them to relax.
Okay.
So what I'm suspecting is that you just have a deep spasm in between your muscles that run down your tricep.
Okay.
And if we kind of force them to open and relax, it'll force the muscle to open up and it should help relieve some of that pain, okay?
Okay.
So I do want to test the range of motion for you. And to do that, I'm going to help you move your arm in various directions. Initially, I want you to kind of give me all of your weight and allow me to move your arm, okay?
Yeah.
So I'll start here. This is kind of a normal position to have your arm in. So I'm going to move your arm just kind of directly out. Any pain with that?
No.
Okay. Can you go out a little further? Any pain here?
No.
I'm going to bring it all the way forward. Any pain there?
A little bit.
A little more here.
Yes.
Okay. So I'm going to start to bring your arm up. Let me know when it starts to become more painful.
Right there.
Pretty painful there.
Yeah.
And the pain is here.
Yes.
Okay. So I'm going to go up a little further. I want you to tell me when you just can't move it up anymore because it hurts too much, okay?
Yeah. Right there.
Okay. Okay. I know that's uncomfortable. I'm just going to fill in between the muscle.
Okay.
I'm going to push down. Does that help at all?
It's pressure. I can feel it.
Okay.
I don't know if it's helping.
And as we go down,
A little less.
do you feel any release there?
A little bit, yeah.
Okay. And then I'm going to slowly bring your arm out. Uncomfortable there?
Yes.
Okay. Go across your chest for me. Is that still painful?
Not as much.
Not as much. Okay. Let's go ahead and relax your arm. Just going to come behind you. So as I suspected, the injury is definitely in between these kind of lateral muscles and it's radiating down. You have kind of a pool of swelling here that lets me know it's trying to drain out, but we're getting stuck kind of in the middle here.
Okay.
So I'm going to do a little bit of release therapy, which is basically just going to help your body kind of drain any of that excess swelling out through your extremities so we're not holding on to it here, okay?
Okay.
So this is going to be a little uncomfortable, but it shouldn't be too much painful. It's going to be more of a pressure, okay? So I'm just going to follow this down. I'm basically just encouraging those systems, your lymphatic drainage, encouraging that to go ahead and move out. Does that hurt when I do? Okay, so I'm going to go in with a little bit of point therapy.
Okay.
And I'll start with something a little less mild. So I have a cold metal applicator.
Okay.
It has a rounded tip and I can use this a couple different ways. I'll kind of show you on your hand. It's going to help me get kind of directly in between those two muscles. So I can either use my flat side or my more aggressive side, I'm going to go in between your muscles and try to loosen up the knot that you have.
Okay.
It's going to be a little painful. If it's too much for you, just let me know, okay? Okay. While I do this, I'm going to go in with a little bit of oil and just prior, I'm going to spray a small amount of lidocaine. It's just going to help with some of that pain, okay? This is very cold. Sorry. So we'll kind of give that a second. It should help within the next 15 or 20 seconds, okay?
Okay, thank you.
Okay, so it's been about 20 seconds and you should feel my hand, but it should feel maybe a little less than before.
Yes.
Okay. So this area where you have that pain, is that a little less painful?
Yeah, a little bit.
So I have a special carrier oil here, and this is just going to help it so that the tool I have glides across your skin easier, okay? So I'll be rolling this onto the area.
Okay.
Do some here, here, here. And I'm going to go down where we have the swelling. Might feel a little bit of tingling, but it shouldn't be painful, okay?
Okay.
I'm going to start with some point therapy here. Any pain with this?
No. That's exactly where it is, right there.
Here?
Yeah.
Okay. I'm just going to go to the muscle that kind of houses these tendons, which is here. I'll loosen it up from the top. And if I hold here and come down to where you feel the pain, you should feel a little bit of a relaxation in that muscle. Okay, so I am able to get in between. I'm just going kind of down and underneath. Go back here. Hold that. Okay, so I want you to bring your hand as far across your chest as you can. I'm going to go back in. I'm going to hold this point. I want you to give me the weight of your arm as I bring it down. We're going to extend here. Extending further. I'm going to bring your arm up. Feeling any less pain than you were before?
Yes.
Okay. Go back down. And go back into a relaxed position. How's that?
Good.
So now I'm going to go in with something a little more aggressive. I'm just going to apply a little more oil. And essentially the same tool, but this point is a lot finer.
Okay.
So it's going to help me really get in there, okay?
All right.
pulsating. This is basically like a physical shock to the muscle. The pulsation acts as like a vibrating indicator to help the muscle release spasm. I'm going to go up and encourage that release. I'm going to go back in with a little bit of manual palpation. Should feel a little looser.
It is.
Okay, so I'm feeling a decent amount of release here.
Yes.
I think we got kind of the main spasm to let go a little bit. So I do want to go ahead and move on to this spot that you said was painful in your back.
Okay.
So I'm going to have you turn around. I'll adjust the table for you. You're going to face the wall so I have access to your back, okay?
Okay.
All right, James, so I'm having a look at your back. Checking again for any signs of swelling. I'm going to do a little palpating of your spine. Do you have any pain or discomfort here?
No.
Good, okay. And nothing on this side, correct?
No.
Looks like you should be having some pain around here. I do feel a little disconnect there.
Yes.
And is that where the majority of your pain is in this area?
Yes, it is.
Here.
Yes.
Okay. Just going in with my hammer. Definitely noticing a slight difference here. Okay, so here and here compared to here, slightly more painful here.
Yes.
Okay. So we've got a slight indentation here where your muscle's been in spasm. Any pain here?
No.
So just want to quickly make sure any sensation loss as I go down here.
A little under the shoulder blade.
Here?
Yes.
Okay. Go across your back here. Here and here.
No.
A little bit here.
Yes.
And here.
Yes.
Okay. And nothing across your neck, right?
No.
All this is, and then maybe just this area.
Just a little right there.
And here.
Yes.
Okay. now measuring. I just want to make sure. 11 and okay. Making some comparisons to see how severe the dip is, but it doesn't look like it's too bad, honestly. Okay, so what I want to do is a little bit of movement to kind of help adjust and reset your muscles. So I'm going to have you sit up very straight. I know it's a little uncomfortable because that's not our natural posture. And I'm going to help align your head properly. Over. Your shoulder up slightly. Okay. And push in kind of under your shoulder blade. Okay. So I'm going to have you bring your elbow back, kind of down and back. Are you able to bring your arm behind your back? Okay. Just going to mark, and that's about what's comfortable for you.
Yes.
Can I have you do the same with the other arm? A little less on this side. Are you right-handed?
Yes.
Okay, so that's normal. Generally have a little more flexibility with our dominant side. Not feeling anything abnormal under the scapula. Okay. So I'm going to do just a little bit of point therapy here. Can I have you lift your arm up above your head again to the point where we felt was less painful? Okay, just going in. Okay, you can go ahead and relax. So even a little more flexibility was shown there than we had the first time, which is good.
Yes.
Okay. So I think as far as the spasmic injury, we've got most of it out. I'm gonna go ahead and have you change back into your shirt, and there's a couple things I want to go over before you leave, okay? So I'll give you a minute and I'll be right back in. Okay. All right, James, so essentially what I found is that you have a spasmic injury. Basically what that means is that your muscle is in spasm. It can be continuous where you are constantly feeling the spasm, which I think is what's happening now because you said you're kind of at a constant, consistent 4 out of 10 in pain.
Yes.
The sporadicness kind of happens when it escalates and it goes to like the 7 or 8 out of 10 with movement. So what I want to do is, first of all, I'm going to send you home with a lidocaine spray, okay? This is 5% topical, so you want to make sure you're not ingesting it. Obviously, you're just going to spray it on the affected area. Okay. You can use it up to 3 times a day, every 8 hours as needed, okay? And I'm going to send you home with some therapy putty. I'll show you how to use it. So just take it out. Okay, so it becomes more malleable as you work with it. You just kind of see what it feels like. Okay. So basically what this does is helps change your muscle memory. So right now what you're doing is compensating for the pain with all of your movements. I'm sure you've noticed as you go to pick something up or you go to touch something, you're doing it differently than you were before because of the pain.
Right.
You don't want to avoid using it because that's not going to help with your injury. I know it seems counterproductive, but you really have to work through the pain.
Okay.
So I'm going to help you with a couple exercises.
Okay.
When you do them at home, I want you to do them as you have the therapy putty in your hand.
Okay.
So you're going to kind of roll it into a ball. It should look like this. You'll notice that as you touch it, your body temperature changes the texture, so it's now more malleable than it was before. And you're just going to keep doing that as you do the exercises. So when you notice it changes, you're going to roll it back up and do it again. So your focus as you're doing these should be engaging your core. You want to make sure you're sitting upright. You're breathing in, focusing on keeping your breath consistent. You're going to hold this in the affected arm. So just for an example, we'll do it here. We have it rolled up. You're going to hold it. You're focused on your engaged core. You're holding it in your hand. You're squeezing it. You're feeling the change in texture. That's what we're thinking about as we're doing this. And you're going to bring your arm up across your chest. Back. We're going to flex and extend. Do it again. Do it again. One more time. And you can relax. On release, I want you to roll it back up. And do it again. This time we're going to go up. So I want you to go. You always want to make sure that you're starting straight.
Okay.
Engaged core. Going to go up as far as you can. Make sure you're breathing. Keep your elbows straight. And back down. And you would do that 3 times.
Okay.
And then the last thing you would do is you would re-engage back in your hand. And you're going to do the exercise we did where you put your hand behind your back.
Okay.
So engaged core. I want you to squeeze it for 3 seconds. Bring it back around the front. You're going to start from 1. And we'll do 2. And then your rotation is 3, and you hold it for 3, and then you bring it back to the front. And I want you to do that 3 times a day. Okay. You should start to feel some relief. Eventually your muscle memory will kind of teach your arm to stay engaged the way it should, because you're not focusing on the pain, you're focusing on what's in your hand. It seems kind of silly, but it really does work. So we're going to do that 3 times a day. I'll give you some printouts just to kind of remind you how to do the exercises properly. I would say within a week or 2 you should be pretty back to normal. Okay.
All right.
Okay, do you have any questions for me?
No, I don't think so.
Okay, well, it was nice to see you today.
Thank you.
Give you that container back.
Okay.
I hope you're feeling better. If for whatever reason your injury gets worse or you don't feel any relief after about 14 days, give me a call and we'll have you come back in.
Okay.
Okay?
Yep.
All right. Well, thank you. Have a good day. Feel better. Merry Christmas.
Merry Christmas.